And with that, we'll start it off. So, hey, everyone, welcome to our 47th COVID-19 office hours for the food industry. We are in an interesting period of transition in this pandemic. According to the New York Times tracker, 42% of Americans have received at least one vaccine dose, and 29% are fully vaccinated. Combined with the people who've recently recovered from COVID-19, we are at least every other person having some level of resistance to COVID-19, and more people are beginning to try new things. I myself joined my very first gathering of fully vaccinated adults this past weekend. It was outdoors, different tables, and we all awkwardly clutched at the masks that we had at our sides because it felt so strange to be doing something that hasn't been possible for over a year. It felt good, and it was thanks right to so many people following those COVID-19 mitigation practices over the last year and the amazing hard work to develop and distribute these vaccines. But at the same time, right, we've peaked in the average number of daily vaccine doses being administered, and several states are well below the national average. The brief pause in the use of the Johnson & Johnson vaccine, which was done out of an abundance of caution to review the extremely rare blood clot cases and make sure that health practitioners were fully aware of the risks and how to monitor for and manage them, has also caused some confusion and concern among the public. We're hearing reports, and I'm sure many of us know individuals who are expressing vaccine hesitancy. People are having a wait and see approach or think with others being vaccinated, they can just get by. But this will have serious consequences for many. We still have a national daily average death toll of over 700 people a day. Personally, I found out that an extended family member who was unvaccinated had decided to host a non-socially distanced gathering a few weeks ago, and tragically they caught COVID-19, were hospitalized, and recently passed away. I don't want to be dramatic, but we are not out of this pandemic yet. So how do we talk to, inform, and convince our potentially hesitant employees, co-workers, friends, and family so that they feel confident and willing to get the vaccine so we can reach a level of community immunity that protects everyone and lets us safely get back to more normal practices? And that's the big question and the focus of today's office hours. We've got a great panel with us to help us discuss these COVID-19 communication challenges, and of course, any other questions you have around COVID-19. So let me introduce the group. We've got Dr. Olga Padilla-Zakor, who's a professor in food science and the director of the Cornell Food Venture Center. We've got Dr. Elizabeth Bin, who is the director of the Produce Safety Alliance and the executive director of the Institute for Food Safety at Cornell University. We've got Dr. Neil Lewis Jr., who is a behavioral intervention and meta scientist at Cornell University and Weill Cornell Medicine. He's an assistant professor in the Department of Communication, Division of General Internal Medicine, and the graduate field of psychology. He writes about the application of social and behavioral science research in public policy and practice, and he's been actively working to increase vaccine acceptance among the public. So we're incredibly fortunate to have him here on the panel today, and I'll pass it to him in a little bit to set the stage on vaccine communication. We've got Dr. Martin Wiedemann, the Gellert Family Professor in Food Safety. He's also the co-director of the New York State Integrated Food Safety Center of Excellence and the Associate Director of the Northeast Dairy Foods Research Center. We've got Dr. Aliosa Trimick, who's an Extension Associate in our Dairy Extension Program and our COVID-19 resource guru. We've got Dr. Callie Neal, who's a professor of microbial food safety in the Department of Animal and Food Sciences at the University of Delaware. She explores the transmission of public health and food safety relevant viruses and pathogenic bacteria. We've got Dr. Ruth Petrin, who is the president-elect for the International Association for Food Protection and founder of Ruth Petrin Consultings, with years of experience identifying and tracking emerging food safety trends and new control strategies. She's going to have to step away early, so if you have any specific questions around cleaning and sanitation, be sure to get them in early. And I'm Dr. Sam Alkame, assistant professor in the Department of Food Science with a focus on dairy food safety and outreach. We've always got our officials from New York State Ag and Markets from both the food safety and dairy divisions on the line if there are any regulatory questions. And I know some of you have already pre-submitted questions, but keep thinking about them. And if you want to ask one, feel free to click that chat button at the bottom, type in your question. You can send it to everyone or just to me, and I'll read it out to the group and get it asked, or you can also unmute yourself and ask the question. But as we always start off, I'm going to quickly hand it over to Al to just give us an update on what's going on for the Institute for Food Safety website, and then we'll proceed with the panel.
Thank you very much, Sam. Yeah, as always, I like to start with our coronavirus boosters that are now bi-weekly. So short videos where we talk about recent COVID-19 trends and some relevant topics. For example, this week we have Karen Ospina and Martin Weidman talking about recent spikes in US and globally, and what are the implications for our food industry. Next part I would like to talk to you about is the management training that we put together. So for food industry managers and supervisors, there's 11 modules that we are putting together. 3 of them are already up there talking about the basics, and module 4 and 5 are just about to come up, where we talk about COVID-19 risk factors and basic control factors. As you can imagine, there's a lot of documents coming out on vaccines. For example, one to talk about is the CDC FDA statement that recommends to continue administration of Johnson & Johnson vaccine. So after the brief pause, we are again using Johnson & Johnson. Other documents on vaccines. So one would be education. So how do you talk about vaccine safety and effectiveness? Next number of documents are on how to organize vaccinations for essential workers, including food industry workers. And there's also some documents on what are the small risks of getting infected with COVID-19 even after being fully vaccinated. One part to emphasize, so visit our page on COVID-19 trackers, just so you're aware of what's going on globally and in your local area when it comes to COVID-19 numbers. We posted one infographic from University of Delaware, where there's a nice graphic explanation of why this virus is so sensitive outside of the host, and the reason why contaminated surfaces and food are not a risk. Last part, visit our page on virtual office hours to find the dates for our next office hours. And with this, I'm going to finish. Thank you very much.
Great. Thanks, Al. So I touched earlier, right, on the challenges we're facing at this point in the pandemic, particularly with vaccine hesitancy. And perhaps it shouldn't be surprising, but communication is a key part of solving it. But it's not easy to do effectively. So I'm going to pass the stage over to Dr. Lewis to start us off with some perspective on how he's been addressing this issue around, right, vaccine communication, and how we should be communicating within our facilities and communities. And then we'll open it up for questions and discussion. So feel free to take it away, Neil.
Thanks so much, Sam. Good afternoon, everyone. Thanks to Beth and Sam for inviting me for the introduction. So as Sam noted, I'm a health communication researcher. I conduct research on interventions to promote healthy behavior change more broadly. But because of that, I've spent much of the past few months working with local, state, and federal agencies on the problem of vaccine hesitancy and how to address it. And we've been working on multiple strategies to build confidence and increase vaccine acceptance, since that's essential for ending the pandemic. So what I'll do is start off with some brief lessons learned from those efforts, some here in New York, others around the country, and then that'll, I think, set the stage for a larger conversation that we can have, answering some of the questions you submitted in advance, as well as new questions you might have now. So the first lesson I want to highlight is that though there's a lot of talk about hesitancy, it's important to note that that term doesn't mean just one thing. So that's the first thing I want to start off by saying. When we started working on this problem back in late November, early December is when these task forces started coming together. We initially thought, well, maybe we could come up with a set of messages that would really address the hesitancy problem more broadly. Hesitancy was a big concern towards the end of 2020, and looking at a variety of data sources. And so we thought about coming up with, one set of messages, but we realized that wasn't going to work. And that the reason that wasn't going to work is that people had many different questions. People were hesitant for different reasons. And so we needed to be able to respond to those various questions to move people along in the process. In December, a lot of people were worried about the vaccine development process. So that was like a big concern back then. They were worried that the vaccines were made too fast. And so that's what initially, a lot of messaging efforts were around. In January, questions a lot of questions became about what are the differences between these vaccines? People wanted to know whether they were getting the good one, right? So that is something that came up a lot. And so we had to be ready to discuss those questions as they came up. In February, there were a lot of stories about side effects in the news. And so people started worrying about those side effects and how it might affect them, and how they should prepare for those side effects and how it might affect their daily lives. So that became the big thing in February. It's of course coming back around again. In March, there were a lot of access issues, and that's still with us. That's something I'll keep talking about. So, people started becoming more and more confident in the vaccines, but then didn't know how to sign up, where to go to get the vaccines and the like. So that was a big challenge. And then this month, of course, the Johnson & Johnson pause has been the story of the month. Reintroducing some concerns about safety that we have to deal with now. But what all of this highlights is that there isn't a one-size-fits-all message, right? The context that people are in, their backgrounds, their identities, and like all those things are going to shape how they're thinking about the vaccines. And so we have to be somewhat flexible and ready to respond to whatever issues are coming up in real time. That's one thing that has been salient over and over again throughout this process. It can feel overwhelming at times because there isn't like the one thing, and it can feel hard to come up with the right message given that everything seems to be changing all the time. But there are some common lessons that we've learned from doing this, and there's some messages that we can keep repeating, and then just know that you have to be ready to respond to other things that come up as well, and there are resources to help you. And so that's what I want to talk about today. The first lesson that has sort of been somewhat universal across these contexts is that we need to still do whatever we can to remove as many barriers as possible to vaccination. New data, as new as last week, still showing that access is still the biggest barrier to vaccine uptake. So we've got to do what we can. People are struggling still to sign up for vaccines, and figuring out where they should go, where they can even go to get a vaccine. And so these are things we have to deal with. And as employers, there are some things you can do to help, right? If there are a few things we can think about. If your employees are having difficulty signing up, one thing you might think about is leveraging some of your resources to help with that. So if you have administrative staff who can help with the sign-up process, help people get signed up, that's one big thing you can do to help. You can also help people make a plan, figuring out like when in the week is it actually going to work for you to go and get your vaccine and help them get signed up for the appointment. That would go a long way. Another thing you might think about if it's possible for you is providing paid leave for your employees so they can have the time to go and get vaccinated and recover from side effects if they have that. And a new announcement actually just came out last week that there are actually tax credits for doing so. That small and mid-sized businesses who offer paid time off can get tax credits for doing that. So whatever we can to address some of these barriers, make it easier for people to get vaccines is like the biggest thing we can do. In addition to that, some employees may have transportation issues. It's another thing that's coming up. So if your workplace can, work with local health providers to schedule shuttles and other services that can help people get to and from their vaccination appointments, that can go a long way still. So as I mentioned, in even new data, and I was reading another story about new data came out even this morning. Again, these access and transportation issues are still bigger problems than these other concerns about hesitancy. Like we built a lot of trust in vaccines over the past few months, which is good, but now we're running into these access issues and we still need to deal with those. So those are some things that we can do. The other thing is, of course, do the best that you can to share accurate and relevant information with your employees. There's a lot of misinformation going around about the vaccines. And so, people have heard things, various things on the internet and elsewhere. do your best not to spread that misinformation, but also then direct people to sources like the CDC and FDA websites, and find ways to translate that information to help people understand whatever the questions are about the vaccine. So those websites, there's been a lot of effort to simplify the information, but getting people to that credible information can be helpful. And it's not just the CDC and FDA that are putting out this information. There are other foundations that have been doing a really good job of this as well. So I've been quite fond of the Kaiser Family Foundation has put together this program called The Conversation, which is a series of videos that they actually worked with healthcare providers to film. When they started, it was 50 videos, and I know they're continuing to add to their database, but they have this monitoring project that's been going where they're constantly surveying the American public to figure out like what are the questions that people have. Then they have healthcare providers actually answer those questions in these short 1-minute videos. So you can share these as another resource to get credible information to your employees. So the broader point is you don't have to come up with all the answers on your own. There are lots of people working on building these resources, but whatever we can do to get this information out to people to answer their questions can go a long way to build confidence, increase acceptance of the vaccines, and get us down the path of ending this pandemic. So I'll stop there for now and open it up. I know there's some questions that were submitted and we can dive into some specific questions, but those are some high level things I think we should think about is still addressing the access issues. That's still #1 priority. But then providing accessible information to people to answer their questions can go a long way as well. So I'll stop there for now.
Oh, that's great, Neil. Well, thanks for setting it all up.